Welcome Internet, and today we're going to be reviewing Schema Therapy in Practice by Gitta and Arnoud Arntz. I'm not in the know who if I've pronounced those correctly, I hope so. To my understanding, they're German, so I've never done any German, so this is my best try. Anyway, before we start, you should know that I don't use Schema therapy. I'm more psychodynamic and existential. So my understanding of the book is what it is. It's not necessarily quite layman's point of view, but it's not necessarily the type of person this book is meant to be for. Meaning that it's meant to be for people that already know about CBT and already have a firm knowledge of that, which isn't really my case. So I'm coming into that half-house perspective in that. However, I found it very interesting. And basically, this is a how-to-do guide on how to do Schema therapy, which I felt was highly interesting. Most notably because it is inspired by cognitive behavioral therapy, but also psychodynamic theories, which I found is quite interesting because we tend to think of those as two very different domains of thought and of therapy, meaning that there might be crossings, but they're not too common. And there's, of course, an incredible turf war on who's right, who's got the best therapies, where's the science, etc., etc., etc. I am not going to deal with any of this because I don't think that's very interesting or appropriate. What I am going to say is that Schema therapy has shown to be empirically very helpful, especially with people who have personality disorders. And that's why it was created for that very purpose. Not necessarily, not by Gitta or Arnoud Arntz. Those are not the people that made it. The man that made it is called Jeffrey Jung, not written in the same way and not the same man as Carl Jung, which I'm sure you'll talk about at some point. But anyway, in regards to the book, I felt it was very interesting because it points out a whole new vocab, a whole point of knowledge, which we don't necessarily deal with in psychodynamic theory. There's also this whole point of organization. It is a very organized therapy, meaning that for those of you who don't know, for example, in the therapies I do, it are therapies that are not necessarily pinpoint. Like, there's not necessarily a protocol. Of course, there's always guidelines. There's always a way, something that goes from session to session, but it's not an obligation. Like, you can be talking about one topic one day and a completely different topic at the next session, and that's how it's meant to be. And it's not a fault. It's a feature, and it's a very important feature in psychodynamic theory. However, in Schema therapy, it seems to be very well organized in a way that, for example, the person is going to be asked to connect to the childhood. That connection is made through what they call the vulnerable child. It's a construct, and they explain it. They're not saying this is hard science. They're saying it's a construct, it's heuristic, meaning that it's a hypothesis, and it's one they're going to go with. And that vulnerable child is basically what the person feels is the most vulnerable part of themselves. And basically, the whole argument is that vulnerable child must be listened to. And the reason why people don't listen to it is because they have internalized, or they have been forced to put themselves into the situation of their parents, in the position of their parents or imagined parents. Meaning that basically they've become more severe with themselves because the parents were severe, hateful of themselves because the parents showed them something of hateful. And basically, those reactions are in three basic types. That's what the book states. The child can be submissive or compliant. The child can overcompensate, meaning becoming aggressive, trying to act out or lash out against, or avoidant, meaning running away. And for them, it's very important to reconnect with that child. That reconnection is mainly done through the empty chair exercises, meaning that you're gonna show the patient an empty chair or many empty chairs. I'm gonna get there. And basically, you ask the patient to imagine basically what would the how can I say, the aggressive parent might say, what the punitive parent might say. And basically it's a dialogue. And I found that very interesting. And it does give very, very practical tools on how to do it. Like there's no, how can I say, poetry or metaphors really of such. It's a very concrete, very how to do it kind of way. But that's where it becomes interesting, because in the cases that they give, and there's many cases, and they're really great, they're really well classed, well categorized, really that the book did a wonderful job at that. But what I found very interesting is basically you get the steps of what they do and how they do it, and you get to see the patients evolve, and that's really cool. But there's a little, like, I would say, if you have read The Gift of Therapy, Yalom talks about how sometimes there's a little special spice that the clinicians don't always share. A little something that's just outside of the books, just outside of the formal training. That little je ne sais quoi in French. And basically, I had that feeling reading this book, and that's what I found very interesting. That basically, yeah, the fairy works out, but there's a little something I think that they're not sharing, or they're not really saying this is how you should be done. There's a humanity that's underlyingly there, but you can't. They don't really talk about it, nor do they talk about their countertransference, meaning their feelings towards the patients. But it's there. You can clearly see that they've given it thought, but they don't explicitly state it. That's what I found very interesting. Also, I found that in those images of those parents, or those, well, what we would call in psychodynamic therapy, those archaic parents in certain types or in certain elements. Well, those things really reminded me of the word imago or imago. I'm not sure how you say it in English. And basically, those are the internalized pictures of the parents, meaning it's not necessarily the real parents, the true parents, people that are out there, but how we've internalized certain behaviors, certain patterns, and certain pictures of our parents and how they react with us. And basically, I found it very interesting, the contrast in vocabulary, how it's so close and yet so far away at the same time. But that was very interesting. I can't stretch it enough. However, there's a little criticism I would talk towards the book, which is I don't doubt that it must massively help borderline personality disorder people, people who have avoidant personality disorder, are obsessive, histrionic. I think that's perfectly fine. However, when they do start talking about paranoid personality disorder or narcissistic personality disorder, I become much more skeptical. Why is that? Well, I think that in those frameworks or in those mental beings states, because even though it's diagnostic criteria, I don't necessarily believe in the truth of diagnosis, but it does show or reflect something of the person. I'm in those two cases, paranoia and narcissism, I'm very doubtful that you can really get them to access that vulnerable child. That being said, they do give examples, but I felt that the examples they gave were the weakest of the whole bunch. Like borderline, brilliant example. Avoidant, magnificent. Obsessive, chef kiss. But those two others that I talked about, I'm much more dubious about it. But it's still something worth keeping in mind. Also, a little criticism. Sometimes they link to a video, a YouTube video that is, which is a fiction. It's not a real therapist doing the scene with a patient, and it's okay. It doesn't have to, but it's a fictionalized therapist with a fictionalized patient, and I felt that it was a very poor choice of imagery to present the empty chair exercise, because to be honest, the therapist is quite brutal, and I didn't feel that they were benevolent. They were more kind of that in-your-face kind of therapist, and I don't know, it kind of put me off a bit. That being said, it's only just like an example. But anyway, I felt that the book was an interesting read, and I would highly recommend it if you have an interest in Schema therapy. if you're of the psychodynamic creed, let's call it, I wouldn't really fundamentally recommend it, except if you're interested, because the thing is that or at least I had the tendency when I read it to say, oh, but we already know that. It's called imago, or it's called identification, or it's called projective identification, and going into my own little spirals. And basically, I liked discovering the new vocabulary, but I don't think it adds that much. Like, to an experienced or seasoned therapist in psychodynamics, I think that Schema therapy is gonna appear more like a watered down version of it, which it's not. It's not. I'm not saying it is, but it's true that because the concepts of psychodynamic are so subtle, so interlinked, so incredibly fine, that any process that simplifies them, which this book and the whole method seems to be a simplification to be able to do it, let's say, in an objective standardized way, is going to lose some nuance at every step. And that's what it is. Compared to psychodynamics, it's a lot less nuanced in how it approaches things, and is much less intricate concepts. They're not going to necessarily dwell into the how, the why. All that meta-psychological part of things is absent, or at least in the practical guide. Maybe it's present in another way, but I didn't find it, at least here. I found that basically it's more concrete. It's hard. It's how to do the therapy rather than the whole interconnectedness. And that's where I think for someone who's psychodynamic, it might fall a little short. If you're really that kind of person that loves the fairies, this is not really the book for you. If you're someone that wants to add to your therapeutic knowledge, someone that's excited about new therapies and wants to discover something new, I would completely recommend this book. I have found it very easy to read, very well structured. Clinically, they give incredible examples of how it works and how you should help the patient, even in the moments where it's hard, which they call benevolent confrontation, meaning that you have to point out that the patient is doing something wrong. All of that is incredibly good advice, and I really feel that it's a good book on that front. But it's not gonna scratch that existential / humanistic vibe that you might want from psychology, especially because there's so many authors like Rollo, May, Freud, that Jung, who have kind of that intuition approach, which is wonderful. You're not going to get that here, or not at the same level. Anyhow, so as a final statement, I would say that it's a brilliant book. It's really good, and if you have even the slightest interest in Schema therapy, please give it a try. Anyway, I hope you liked the video, and if you feel that I've misrepresented or got something wrong, or would like to just ask something or even to debate, please feel free to drop off a comment. If not, I'll see you in the next one. See ya. Bye.